Hello! Today we're going to talk about Ling 1 and its use in treating symptoms of postmenopausal syndrome. Traditionally, Ling 1 is a medicine in TCM that comes under the Hormone mode of treatment, meaning that it improves blood circulation and eliminates blood stasis. Biomedically, Ling 1 is able to treat hot flashes experienced by patients with postmenopausal syndrome. Hot flashes occur when blood vessels in the skin widen and dilate, increasing blood supply to the skin surface as well as raising skin temperature. The skin reddens and the patient feels warm, often also experiencing chills after the hot flash ends. In postmenopausal syndrome, low levels of estrogen result in lowered production of a neuropeptide called the calcitonin gene-related peptide, or CGRP for short. CGRP is a vasodilator in the sympathetic nervous system, the part of the nervous system responsible for the fight or flight response. This means that CGRP causes blood vessels in the skin to dilate, increasing blood flow and blood supply to the skin. Now you might think that in postmenopausal syndrome, if CGRP is low, then the blood vessels remain narrowed, blood supply to the skin is lowered, and therefore skin temperature also remains low, right? What actually happens is quite counterintuitive. In patients with low CGRP levels, the body responds by increasing its sensitivity to the small amounts of CGRP that it can produce. It increases production of CGRP receptors in larger quantities, which means that a smaller amount of CGRP provokes a more extreme response. The skin blood vessels dilate and temperature goes up, resulting in a hot flash. Ling 1 is able to raise CGRP levels in the blood without also increasing estrogen along with it. Higher CGRP levels allow the body to produce fewer CGRP receptors, decreasing its sensitivity and alleviating the hot flashes that often accompany postmenopausal syndrome. However, Ling 1 can achieve these effects without affecting estrogen levels. This is important because continuous high levels of estrogen can increase patients' risk of cancer, including cancers of the breast, ovaries, and uterus. Ling 1 also does not affect levels of the hormones FSH, follicle-stimulating hormone, and LH, luteinizing hormone, which play a role in estrogen production. It may be beneficial to consider using Ling 1 in a clinical setting to specifically target hot flashes in the treatment of postmenopausal syndrome.